Before I share my screen, just to say a few words, I'm going to talk about virtual care in general, and also kind of take a look about what happened before COVID and how COVID has impacted telemedicine or virtual care. As you all know, virtual care and quote unquote telemedicine has been around for a very, very long time. And it's been a really uphill battle in terms of getting clinicians as well as patients to agree to use it. Somehow we have a tendency to want to do person-to-person, face-to-face care. But I think that we are undergoing now a very disruptive kind of a change because of the crisis. And I want to kind of share what I think, what it looked like before and what has happened. Basically, I talked about closing the gap for cancer patients, but really cancer patients are just an example because they are such a vulnerable group. And I think I'm going to start with this quote by Christian Otto from the director of tele-oncology at Memorial Sloan Kettering Cancer Center, who's basically said, those who do not encourage virtual care are going to fall by the wayside, and those who do provide digital platforms will succeed because patients are going to go where the convenience is. And what's interesting is that in every other facet of life, we are all using digital technology all over the place. As you can see here, the numbers are just incredible in terms of internet users as well as smartphone users. And even in healthcare, we already saw prior to COVID that smartphones, tablet devices, related apps were already being used by doctors and nurses in the clinical settings. And we have examples of these, which I'm not going to read you my slides. And even in the area of remote monitoring, we also saw prior to COVID a significant amount of growth in terms of patients who were remotely monitored. And this is like a graph, a worldwide graph, which really shows that beginning at 2015 until 2020, there's been tremendous growth, and up to 2021 is projected to be even more dramatic. And this was before COVID. But having said that, there was a very interesting report that was published by OECD at the beginning of this year, and basically said, okay, telemonitoring has increased. There's a steady increase in the number of organizations and healthcare organizations and patients using it. And there's been a lot of studies. And despite all of this, rates overall of telemedicine use remained low. And there were very few programs at the national and regional level, a lot of projects, but not really integrated into everyday care. And one of the reasons for this is that, at least until now, the health sector invested less in information and communication technology than other sectors of the economy, which is an answer to, by the way, a question that was raised earlier in the symposium, which is why has the healthcare sector lagged behind? So if we look now at specifically at oncology care, I couldn't find any overall numbers, but I found lots and lots of studies. And studies that were also meta-studies. And so you can see that basically over the last, 10 years, their digital care has been being used for oncology, for cancer care, and increasingly so. And their conclusions are that it's very promising, provides benefits, has demonstrated improved access, and patients have a positive experience with it. And yet it took COVID to really accelerate this process. So the thing that happened and was identified very early on in the COVID situation was that COVID-19 has had a devastating impact on the care of cancer patients. And we got some terrible statistics. The UK, the Cancer Research UK basically said there's a tremendous backlog of people requiring cancer care, and estimated 6,000 additional deaths The United States even estimated, obviously larger numbers because it's a larger country, but the additional 34,000 deaths due to diagnosed cancer patients in the same 12 months. And basically the conclusion was that tele-oncology has become a necessity. And for people with cancer, it's extremely important that there are no interruptions to treatment or other vital services, which was the big threat of COVID. And so essentially COVID-19 has been a game changer for telemedicine in every aspect, I think, of medical care. And we saw it was just like a phenomenal, unbelievable thing that was experienced. And I'm just throwing some numbers out from a couple of places, but I think this has been a global experience. In the UK, it basically went from 10% of general medicine consultations to approximately 75% at the peak of the first wave of the pandemic. The USA also saw a tremendous surge, and cancer centers also saw a tremendous increase in the use of telemedicine. At Thomas Jefferson, for example, they said that the number of telemedicine visits during May was equivalent to that anticipated for the entire year, and many centers moved from 40 telemedicine visits per year to 4,000 in a month. And we saw this all over the globe. And not only that, but really key organizations that set guidelines said, use telemedicine. The European Society for Medical Oncology said, use telemedicine. The National Health Service in England issued guidance to support the use of telephone or video consultation. The United States relaxed all of its restrictive regulations in order to encourage people to use telemedicine. And so this is what we saw. We saw that as inpatient person visits dropped, telemedicine visits rose rapidly. And even though after the first wave, when we all thought it was all over, the percent of virtual visits was declining, but still well above pre-pandemic baseline. And if I take my own experience in a sutta, which I think is fairly typical. And I participated the other day in the Scottish Digital Health and Care Conference, and both Denmark and Scotland reported exactly the same trends. What we saw was teleconsultation went up very rapidly during the first wave, and then it went back down very dramatically. And then we had a second wave. And in Israel, I think the second wave started earlier than it did in Europe, and the numbers are going up again. And I think that in a way, as far as sustainable telemedicine or teleconsultation, the second wave had greater influence, because the first wave, everybody was using ad hoc solutions and basically said, okay, we're going to do this now and then it's going to be over. And then when the second wave came, they said, oh, but it's not over. So we really have to make a systematic change in the way in which we are caring for people. And so what are people saying that the future is going to be like with virtual care after COVID? So I think that all the telehealth experts understand that technology will never completely replace in-person medical care. But at the same time, for cancer patients specifically, or for example, a telemedicine visit can save quite a bit of time, money, and stress, because they have a lot of visits to the clinic. And even though we saw that the number of remote consultations started to level out between the waves, I think there are indications that telemedicine is here to stay. And Martin Marshall, the chair of the Royal College of GPs in England, basically predicts that up to half of GP consultations will continue to be remote after the pandemic has subsided. Now, I think this is not going to happen automatically. It's not going to happen by itself. There's stuff we have to do. So let's look at the challenges that we identified both pre-COVID and during COVID. One challenge was developing and implementing digital solutions to suit most patients. And that's, the whole usability by patients and comfort of patients is a really crucial issue. A major challenge was developing teleconference systems that clinicians were happy to use. The clinicians were not really, they weren't happy campers, and they basically used it because they had no other option. But what we want to do is make them use it because they're happy to use it and they see the benefit. Nurses were concerned that this was going to create some kind of or hinder the development of personal relationships between patient and nurses. And that's a concern that has to be addressed. So essentially, what we see as kind of conclusions that the potential is great, but in order to be successful, we have to focus on appropriate training, education, and reimbursement. And digital health solutions, and I think this is a really key point, have to be integrated into the patient pathway and the healthcare team practices. It can't be a kind of a standalone thing. It has to be part of the existing system. And we'll sum it up basically with a quote from that OECD report, which I think really says it all. Telemedicine services are both technological and service innovations, and they go much further than simply digitizing traditionally analog healthcare processes and services. They fundamentally reorganize processes, procedures, and services. And I think that's really the take-home message when we look to the future and the ultimate sustainability of virtual care. Thank you very much.